Ladies, are you suffering from pain in your knees, shoulders, or maybe all over and you can't think of anything that you did to cause it? Are you also in your late 40s to early 50s? In this video, we're explaining how menopause can actually be the surprising cause of pain and inflammation. Welcome to the Health How To channel, where we talk about some great life hacks and easy tips to achieve better health. Please subscribe and share what you did to help with your aches and pains during menopause so that we can all benefit in our own personal journey to better health. Menopause is a natural biological process in a woman's life, typically occurring in their late 40s to early 50s, where they cease to have menstrual periods, marking the end of their reproductive years. This transition is primarily characterized by a significant decline in hormone production, especially estrogen, and can bring various physical and emotional changes. Sure, we might be aware of common side effects like hot flashes, night sweats, and mood changes, but did you know that the drop in estrogen can also lead to musculoskeletal pain and a breakdown of your cartilage, bone, and muscle? And it doesn't start all of a sudden when you're officially in menopause, considered to be when a woman has gone 12 consecutive months without a menstrual period. Musculoskeletal pain and increased inflammation can actually start in perimenopause, a phase that can last 3 to 5 years before leading up to menopause. During perimenopause, a woman's ovaries start to produce fewer hormones, particularly estrogen. Other key hormones decrease as well, like progesterone, follicle-stimulating hormone, luteinizing hormone, and testosterone. A number of studies have shown the correlation between mild to severe musculoskeletal aches and pain starting from pre to perimenopause to menopause. Migraines and headaches can also change. Some women feel their migraines are less frequent during menopause, while others may start to experience headaches due to the hormonal fluctuations during perimenopause. So, what is it about a decrease in estrogen that correlates to increased joint pain and stiffness? Estrogen has a role in the growth and repair of cartilage, the smooth, flexible tissue that covers the ends of bones in joints. Estrogen also helps to keep joints lubricated and assists with the absorption of nutrients that nourishes our cartilage and keeps it healthy. So, when estrogen levels decrease, our cartilage becomes thin, dry, and doesn't repair. You can see that process in our skin when it loses its plumpness, firmness, and elasticity. Well, the same thing happens on the inside to our knees, hips, and hands. With lower estrogen levels, joints can become less lubricated, leading to increased friction and wear and tear within the joint. This can result in pain, inflammation, and stiffness. We might start to hear more knee grinding when we come down the stairs. Our shoulders might pop when we reach for a dish up high. We start having back pain when we get out of bed. The breakdown of cartilage in the joints can lead to a condition called osteoarthritis. Osteoarthritis is the most common form of arthritis. It's referred to as wear and tear of a joint, bringing on joint pain, swelling, and limited range of motion. Arthritis can come and go, but women who are perimenopause or menopausal may experience more significant pain and stiffness during this transition due to rapid changes in estrogen levels. In addition, estrogen has an influential role on the body's inflammatory response. Estrogen helps to increase and decrease inflammation. Sometimes when we say inflammation, we automatically associate it with something bad, but inflammation is a natural process that is crucial. Imagine the inflammatory process like a bad multi-vehicle accident on the highway. Someone calls 911 to start the process. Beneficial inflammatory cells are similar to the emergency services that rush onto the scene. Firefighters put out the fire and pull people out of the cars. The paramedics assess the situation and start life-saving measures and take people to the hospital. The tow trucks come onto the scene to take away the crushed cars, and the police come to direct traffic and investigate the scene. Now, what happens when inflammation becomes a bad thing is when the accident scene isn't cleared out quickly enough. So you can imagine that maybe the traffic starts to back up for miles and miles. The ambulances and fire trucks can't get out. There's not enough police to direct all that traffic. There are no alternate routes. And then we have one massive traffic jam that is getting worse and worse by the minute, and drivers that are red-faced and so very angry. This is inflammation gone bad. One of the ways estrogen can affect the balance of pro-inflammatory and anti-inflammatory substances is seen with frozen shoulder syndrome. Rotator cuff capsulitis, also known as frozen shoulder, is extremely painful and severely limits your arm movement. The exact reason as to why it happens isn't clear, but it is as a result of significant inflammation of the soft tissues around your shoulder. Who tends to get frozen shoulder? Women in their 40s to 60s, people who have had recent shoulder injuries, and people who wear slings. A small percentage of people who have diabetes, recent stroke, Parkinson's, and thyroid issues may be at risk for frozen shoulder as well. Unfortunately, sometimes the unaffected shoulder will also go on to develop frozen shoulder too. Finally, estrogen is also responsible for maintaining bone density. What does that even mean? Well, we can think of the inside of our bones as having a honeycomb matrix. Healthy young bones have small, orderly, and tightly packed walls to give maximal strength to our skeleton. But as estrogen starts to drop, the walls of the honeycomb start to deteriorate faster than our body can rebuild them. If this process gets worse, we get osteoporosis. Just like the Colosseum in Rome, the walls now have holes, they're not structurally sound, and many walls are missing. As you can imagine, women with osteoporosis have a high risk for fractures of their spine, hips, and wrists. Check out our video on osteoporosis for some tips on how to build stronger bones. So, what can be done about an inevitable life change? Make sure you do these 4 things. Number 1, weight-bearing exercise to promote bone growth and denser bones. The maximum amount of bone we will grow occurs in our 20s. After that, bone loss happens at a rate of about 1% each year, and bone loss speeds up after menopause. Weight-bearing exercises for the lower body can be as simple as walking, climbing stairs, doing squats, and lunges. Weight-bearing exercises for the upper body means putting weight through your arms with push-ups, planks, and pole walking. More advanced weight-bearing can include jumping activities like dancing, trampoline, using a skipping rope, and of course, sports like tennis and basketball. Swimming, although great for arthritis, is not considered a weight-bearing exercise. Number 2. Weight training to build muscle, which reinforces your joints as well as boosts your energy and metabolism. Remember that a high body mass index correlates to a higher risk for hip and knee replacement surgery as well as pain. The key to effective weight training is that your muscles must feel fatigued after 5 to 8 repetitions. In order to truly stimulate your muscles to grow, you must lift a heavy enough weight. Most women shy away from using weights because they're afraid they might look bulky. This will never happen because we don't have enough testosterone. True, if you spend 5 hours a day lifting truly heavy weights and following an extremely strict calorie-reduced diet, you may one day look like a competitive bodybuilder. But for most women, this is not a reality. So go ahead and lift heavy weights 3 times a week. We lose 1% of our muscle mass every year, starting in our 30s if we do not exercise. Number 3, eat an anti-inflammatory diet. In general, that means to eat more fibrous vegetables, including leafy greens, foods high in omega-3 fatty acids like flax and salmon, lean proteins, and cut out added sugar. Check out our videos on how to naturally increase your estrogen through food, as well as all of our other videos on how to eat to reduce inflammation and reduce stress. And number 4, consult your doctor for baseline testing of your bone density, vitamin D, and B12 levels, and to answer any questions you may have about pain management, supplements, and hormone replacement therapy. Is there anything that you found had helped with your menopause symptoms? Let us know in the comments section. Please subscribe and turn on notifications so you don't miss any health how-to videos where we talk about easy ways to improve your health. Thanks for watching, and I'll see you in the next video.